Today we're joined by Dr. Sharjah Waqar, the consultant of pulmonology at the Pulmonology Department at Zahra Hospital in Sharjah. Hi doctor, hope your day is going well so far. Now, can you tell me, what are the symptoms of sleep apnea? Like, how do I know if I have sleep apnea?
So sleep apnea is basically a condition when people during the sleep, they stop their breathing, called breath holds, and that defines sleep apnea. The symptoms are these patients can have snoring, they have interrupted sleep, they wake up at night, sometimes they wake up for using toilet and they think this is just because toilet, but that can be part of sleep apnea, you have to remember. They wake up in the morning very unrefreshed, as if they did not have enough sleep, can be very tired. During the day, as they go to work, they feel tired and sleepy, and sometimes they can fall asleep. You may notice them on their desk, they can fall asleep. Given the circumstances, they may fall asleep very quickly during the day. And this cycle goes on. These are common symptoms of sleep apnea.
And how do I get a proper diagnosis for that?
Diagnosis is one, if you have such symptoms, it's important to consult specialists, sleep specialists like myself, or a good respiratory physician, and we do what we call sleep study. So for that, we conduct one overnight sleep test, which records your sleep pattern, and we go through the sleep test, and we see how many times you stop breathing at night, and it gives full history of your sleep at that night, and we make a diagnosis based on that.
And what's the best treatment for sleep apnea?
Best treatment depends on patient's body habitus. Weight loss, of course, is recommended in such cases, but gold standard treatment for sleep apnea is what we call CPAP. It's continuous positive airway pressure, which is basically a little machine like people have an oxygen mask. It's connected to a mask, like, as I said, an oxygen mask, and you put on your face when you go to sleep. And basically the idea of that is to keep your airways open and prevent from stopping breathing, which you're doing with this illness. It's called CPAP, and that's our gold standard treatment across the world.
Now, what will happen to me if I don't get treatment?
Those patients who leave it untreated because they just don't want to get treatment for whatever reason, the problems can be it increases or doubles the risk of stroke, it increases the risk of your heart attack, it increases the risk of your heart failure. Cardiovascular risk factors are doubled. As I said, stroke and heart attack are main worries in untreated cases. So these patients have to take this very seriously. Otherwise, they can develop other conditions which I just mentioned.
And in addition to that treatment, what else can I do to, help this condition?
In addition to the CPAP treatment I mentioned, they obviously need to lose weight if they are overweight. They have to do regular exercise. They have to walk. They have to eat well. Sometimes if there is a problem within the ear, nose and throat, sometimes they can have some problem in the nose, like nose septum can be deviated. We can look into that and we will refer accordingly. But from patient perspective, weight loss, exercise, eating healthy, and monitoring, keeping their blood pressure in control. That's the main things which they can do to help this condition for themselves.
Thank you very much, Dr. Sharjah Waqar, the consultant for pulmonology at Zahra Hospital, Sharjah.
Thank you.